Assalamualaikum everyone, welcome back to my YouTube channel. In this video we will talk about acute renal failure. तो acute renal failure को देखेंगे. इसमें हमारे पास जो है acute reversible deorientation होगी renal function की, which develop over a period of the days. मतलब कुछ दिनों के बाद होगी, rarely weekly, or result in uremia is called acute renal failure. This is reversible and can be curable in 10 to 25 days. Renal vein contain deoxygenated blood while the renal artery contain oxygenated blood. Etiology of the renal failure may due to the pre-renal, renal or post-renal causes. So now we will talk about what are pre-renal, renal and post-renal causes. Pre-renal ARF. The kidney are inadequately perfused and the GFR greatly diminished. This may be due to decreased cardiac output in the cardiac failure, underfilling of the vascular bed due to hemorrhage, severe fluid depletion and vasodilation resulting from sepsis. Renal cause of ARF. Disease of renal arterioles such as vasculitis, microorganopathy, hemolytic state, rapidly progressive crescent GN, injury to tubular cell by toxin or ischemic intraluminal obstruction of nephron from precipitation of crystals of protein, acute intestinal nephritis due to infection or drug reaction, post-renal cause of ARF, change in urinary bladder and urea common due to obstruction. ARF is due to obstruction of the urinary tract at any point in its course. Now we will talk about the pre-renal acute renal failure. This is called pre-renal azotemia. About 70% of the cases of acute renal failure are due to pre-renal cause. Pre-renal ARF result from hyperperfusion of the kidney due to decrease in effective arterial blood volume. It can immediately be reversed with the distortion of the renal blood flow. Renal parenchymal damage doesn't occur. If hypoperfusion persists, ischemia can result, causing intrinsic renal failure. Common causes are volume defect, which are given in the form of every system, cardiovascular failure, acute cardiogenic shock, decreased systematic vascular resistance, sepsis, intravascular hemolysis. Causes of pre-renal failure: reduced circulation, blood, hemorrhage from any cause including complication of pregnancy and trauma, GI bleeding, loss of plasma as in burn and crushing injury, sodium and water depletion from GI tract in severe vomiting, diarrhea, acute intestinal obstruction, paralytic ileus, pancreatic fistule in urine due to excessive treatment with diuretic, diabetic ketoacidosis from skin to sweating, reduction of the cardiac output and MI failure, cardiogenic shock, peripheral vasodilation, spasticemia, intravascular hemodialysis, rhabdomyolysis, breakdown of skeletal muscle due to the toxic effect of kidney of released globulins, disease of major renal vessel. This disease which result in renal underperfusion, thrombosis of aorta or renal arteries or aortic aneurysm. Clinical features are obvious: hypotension and sign of inadequate peripheral perfusion, decreased urinary output. Diagnosis: complete history, clinical finding, progressive increase in blood urea and plasma creatinine, serum BUN, creatinine ratio 20:1, urine sodium more than 20% MEQ/L, urine osmolarity more than 500 mosmolarity by kg. Urinary indices for the diagnosis of pre-renal and renal ARF: urine osmolarity and urine plasma creatinine ratio BUN and fractional exertion of the sodium are given in the form of pre-renal and renal causes. Regarding that, if you have any issue Ask me in comment section. Thank you so much for liking and watching the video.